All right, Ankur, welcome to the channel. You are an emergency medical doctor in India, host of the Desi EM podcast, and you are also a proponent of a carnivore dietary approach, especially for your medical patients, of course. Welcome to the channel.
Thanks a lot, man. Eddie. It's good to see you again.
Yeah. Um, so as we were just discussing before we were recording, last time I was on your podcast and we talked about a lot of things. But one of the things that we mentioned was that you are conducting studies in your own emergency practice about, what is actually caused. It's observational studies, of course,
Yeah.
but they still have utility because they can sort of point us in the direction of what is really causing a bunch of these heart attacks that you see in your practice, despite the fact that many of your patients are sort of on the vegetarian realm and the vegan realm, which makes sense considering that India it's a very highly vegetarian population due to a lot of reasons.
Yeah.
And so I was curious, what for the viewers and also for me, because I don't know all the details, what are these studies specifically that you've been working on? What do they entail? And why did you decide to do them in the first place?
Yeah, I mean, my journey actually goes back like 4 or 5 years back when I started onto my metabolic journey.
Hmm.
When I figured out that my triglycerides had hit 600, right? And I've told you this before, and I realized that there's not much of nutrition that I know. I just knew that probably I need to take some statins and some antihypertensives at that time because my blood pressure was also a little high on that at that time, coincidentally. Uh, But yeah, 6 months down the line, I stopped all those medications. I started researching into nutrition and metabolic syndromes, and I read Robert Lustig's book first, which is Metabolical, and it just took me down the whole rabbit hole. And I mean, it's a long story now, but what I actually also saw was my patients. I actually figured out we're not doing anything to our patients. We're not actually saving lives. Even as an emergency physician, I'm not actually saving a life because I might save that life in that moment, but they go into the ICUs or the cath labs, get the procedures done, and then they're discharged on medications to be kept on medications for life. Uh, and they're given the same dietary advice like everybody else gets, which is cereals, legumes, lentils, fruits, vegetables, and very little animal meat or milk. And then I realized, hold on a second, most of my country actually eats this. And then there were a lot of people who were willing to argue, oh no, I mean, a lot of people are non-vegetarians. I'm like, yeah, I mean, they are. But then how many of them actually eat meats every day for every meal, right? Most of the non-vegetarians in India eat once a week or twice a week. So I have a lot of resources because we get a lot of patients in my emergency department, and I have an academic program in emergency medicine, and all my residents have to do research projects, right? So I had 7, 8, 10 ideas, and I just distributed all those ideas amongst my residents, and I actually wanted to see what's happening in my patients. And yes, you're right. They all have to be observational, epidemiological studies because it's not possible to do randomized control studies for nutrition and emergency medicine together. And so one of the studies, which is one of my biggest ever studies, we've just crossed data for 10,000 patients. Uh, so we were actually questioning patients coming in with whatever the chief complaint was. They came in with whatever emergency they had, but if they had a history of diabetes, heart disease, hypertension, PCOS, Alzheimer's, cancers, and a few other bunch of metabolic syndromes, we had like a set of 32 questions. It's not just about what you eat, it's going through everything, your dietary preferences. We're not asking each item what you're eating. We're getting onto that later on, but
Hmm.
something like what's your dietary preference? Is it vegan, vegetarian, omnivore, ovo-vegetarian, pescatarian, carnivore, etc.? And then if you are an omnivore, an ovo-vegetarian, or a pescatarian, how frequently do you eat those meats? And we usually give them the option for every day, once a week, once in 2 weeks, monthly, uh, and then we have the sugar intake, exercise, alcohol, smoking, all of that. Uh, and we're also actually asking them about the NOVA groups also, right? So you have unprocessed, processed, and then I think that's NOVA group 1, 2, 3, and 4. So from unprocessed to completely processed and ultra processed foods. And yeah, so in these 10,000 patients, 65% are pure vegetarians, right? They don't even touch eggs. right? And then the rest 35 are like a combination of pescatarian, ovo vegetarians, and omnivores who eat the fish or eggs or chicken, mutton, like mostly once a week or once a month. So, I mean, if you don't want to say that vegetarianism is, quote unquote, causing these diseases, you also cannot claim that eating meat is causing these, or not eating meat is keeping you safe from these diseases, right? So that's one of the inferences that's definitely going to come out. I think we've got another 2 or 3,000 patients to go, and then we'll go and get into the final analysis phase, and then hopefully get it published. No, hopefully I will get it published. I don't know where, but I will definitely get it published. And I think the emergency medicine journals are a good place to go because uh, I am an emergency physician. This is a study conducted in an emergency department, and the field of emergency medicine has always been patient centric, and we're really strong advocates for our patients. And you know it yourself. I mean, even in the US and all, you see because of the insurances and or in England, the NHS, we are the safety net for the population, right? I mean, even if you don't have money, we still have to treat you. We still have to, manage whatever we can manage, right? And get you as well as possible. Uh, so yeah, I mean, emergency medicine is still untouched, hopefully, by the propagandas and and then I actually saw that because I tried to publish my case series of my STEMI and B12 homocysteine
Hmm.
levels and the internal medicine and some cardiology ones. I actually didn't even find peer reviewers to review them and rejected it, right? So I was like, you can't find peer reviews. That's a very weird way of rejecting. That was the first time they've rejected any of my papers. Like by actually quoting, they couldn't find a reviewer for that. And I sent it to the American Journal of Emergency Medicine, and it got published in the first go. So yeah, so that's one of the studies that I'm doing. That's one of my major ones. Another one that we're looking at is all the patients coming in with non-alcoholic fatty liver or
Mm.
metabolic dysfunction associated liver disease, right? That's the new name for that, or steatohepatitis MASH, right? So yeah, we're looking at that and the dietary preferences. Another very interesting one that actually we started off, which is a lot of people actually claim the Lancet study that India has only 11% diabetes, which is absolutely untrue. It's I don't know why people even believe that because every second person you meet over here has pre-diabetes or diabetes. And so we're actually looking at the young adults, a lot of them who don't get tested or who feel that they're fit, right? We're looking at the young adults. I think that's up to the age of 45. I think we're taking from like 20 to 45 or something like that. And if they're walking in with a random sugar of 140, we're including them in our study. We're sending their HbA1c levels and seeing if they have diabetes by definition or not, of the glycated hemoglobin. And I think in the last 2 or 3 weeks, we've got about 77 inclusions into the study. Out of 77, 37 turned out to be diabetic. That's almost 50%, right? And out of those 37, I think about 28 or 29 were vegetarians, and the rest eat meats once a week. So again, plant-based omnivores. But this is going to be an
Yeah.
interesting one because this is going to go on till like next year, 2026 December.
Mm.
So, so we're going to get like thousands of patients. And then the reality is going to actually come out that there are so many undiagnosed diabetics walking around, and these are the young ones. We're not even talking about 60, 70-year-olds. We're talking about 20 to 45 years olds, right?
Right.
Uh, and we're looking at all the aspects, through all of these researchers. We're looking at there's one where we're looking at the frailty and the muscle strength, where people are coming in, the elderly age group is coming in with trivial falls, fracturing their wrists or the hips, and we're taking their dietary preferences. We're doing the muscle strength tests through the grip strength and all of that, checking that out. We're doing another one with heart attack patients, all are STEMI, ST elevated MI patients. We're getting the lipid profiles, B12s, and homocysteines done. And I've shared that content online also, where most of them, actually, almost all of them actually have high triglyceride to HDL ratio, all of them. And I think a few do not have low B12 because they're on supplements. So, it's like thousands and 2,000s. and yet the homocysteines are still high. This through the synthetic B12, we're seeing that the homocysteines are not settling down. So I think we've collected about 98 to 99 cases till now. Uh, and out of that, only probably five have normal B12 levels or ideal B12 levels. And almost all of them have really high homocysteine levels, which we know is a procoagulant. It can offer thrombus in the artery. So we're seeing that cholesterol levels are not that high. The LDL levels are not that high. TG to HL ratios are high, right? And then we're looking at their dietary intakes. We're also, our secondary outcomes. We're actually looking at how many of them have had a heart attack the second time or the third time. If
Mm,
they've been on statins from the first time, who did
right.
they get their lipid profiles checked the first time they had the heart attack or not? If not, what's the lipid levels now? And most of them have absolutely normal, like the ideal lipid profile as per a cardiologist, right? And then you still end up having a heart attack and you're eating what they told you to eat, cereals, grains, legumes, lentils, vegetables, fruits. That's what you're eating. You're not eating any meat, you're not eating any fish. And you're a non-smoker, you maybe have occasional alcohol, and that's about it. And then you're still having your second or your third heart attack. So we're looking at that also. So yeah, really interesting stuff going on. And it's eye-opening, not just for me. It's eye-opening for my team because they're
Hmm.
seeing it. I keep telling them, like I've seen the Matrix. It's time that you guys open your eyes and understand uh, that we were doctors first and emergency physicians later, right? So we became doctors to actually cure, and I think this is the way to go. And I'm happy I'm trying that I'm making some inroads into some doctors. Uh, a, a colleague of mine, a urologist, his son has type 1 diabetes, and he came in with some infection, with an appendicitis, right? And he's on a CBG, and his mom's also a doctor, and she's into fitness and stuff. And I'm like, what's his usual range? He's 14 right now. I'm like, what's his usual range of his sugars? Like, stays about 200, 250. I'm like, that's not good control. How much insulin are you giving him every day? She's like, twice a day, it gets to about 40 to 50 units. I'm like, you don't want this to happen from 14 till whatever age he lives up to, right? I mean, it's only
Yeah.
going to get worse. And thankfully, they're omnivores. And I after the surgery, I put him on chicken soup and eggs, and now they started eating more of red meat and reducing his carbohydrate intakes. And I get messages from her that his sugar spikes post meals have gone down, his insulin requirement is slowly going down. Like, I mean, just be consistent. Probably you just need 1/10 of the insulin that he's on right now, and she's really happy with that. So yeah, if it works out, or maybe she's going to just promote some more of this.
Yeah, let's hope. Yeah, so I think that all of that is really important. I'm actually, people might be surprised to hear this, but in terms of observational studies, I think that actually the signal that you get from observational studies can be a lot more informative than the other types of studies that you get. The more reductionist you get, the more noise is around your signal,
Yeah.
if that makes sense. So as long as the sample size is big enough, I think that as long as you're responsible with the way that you convey the results, saying it's not causal, this is just an association to make an inference about, I think that actually more of those need to be done than all this other sort of bread and circuses type of science. So I'm actually a fan of what you're doing. I wanted to ask, I know that the studies aren't done yet. Like you said, one of them is going up until about 2026, December of 2026. Um, I wanted to ask though, as you've been doing this, have you been seeing, if you've actually looked at any sort of data so far, like a cumulative data set, if that's even possible, or even if you haven't, just based on what you've seen, what are the biggest associations that you've actually been seeing? So if you look at, I'm sure that you already mentioned this, total cholesterol and LDL, they're quite low, and yet these people are still having a lot of these issues that like the heart-related issues. So that would be sort of a low association between total cholesterol and the heart health outcomes concerned there.
Yeah.
What are the higher ones that you're seeing? Is it I mean, I would presume, of course, the obvious one is the higher fasting blood glucose A1Cs, but are there any others that people may have, may think are um they didn't anticipate being a strong association at all? Have you seen anything like that? Surprising associations?
Yeah, I think B12 and homocysteine for me, because I mean, we've read about it and just, let it be, go into the past. All right, you need B12, you can get, because there's so many supplements. You don't actually think about that. And it's showing such a strong association with not just heart attacks, but even dysrhythmias, something like supraventricular tachycardias. I've got patients who are, again, not eating meats, and they come in with a heart rate of 200, 220, because one part of the heart is beating really fast, right? I mean, the part above the ventricle. So it's firing at that rate. Yeah, I mean, studies have shown that, that there's an electrical pathway, there's an extra pathway that can get formed and all that. But why does that happen? Why is that happening? We know B12 is required for a lot of our nervous system functioning, right? And probably that could affect uh, the nerves and the fibers of the heart. We don't know yet. But
Hmm.
then if I'm seeing that they're so deficient in B12 and they're really high in homocysteines, right? And that can damage a lot of things. Even coronary artery disease can cause dysrhythmias. So if you
Right.
have high homocysteines, you might have a coronary artery disease, which you haven't been detected yet because it's not caused a heart attack yet, but it might be giving you a signal by getting you into a supraventricular tachycardia stage.
Right.
You don't know that yet. So I actually tied up with one of the cardiologists. He's unfortunately leaving, but I was telling him, I mean, on your call days, if I get an SVT who has no comorbid condition, no known comorbid conditions, comes in with this, is a vegetarian, I'll send his B12 and homocysteine and his lipid profiles. If they're the way that I think that they're going to be, let's get them counseled to get a CT angio done instead of, angiography, and get a CT angio done and see if they've got coronary artery disease or not, critical or non-critical, whatever, it doesn't matter. But he's leaving, so I'm going to ask some other cardiologists if they want to, get into this and do that. So I think this is something that's really important. And why this is important for me is because India being such a vegetarian country, I'm seeing B12 deficiencies in almost all my patients,
Hmm.
everyone, and they're all either put on supplements or people just get the test done and forget about it because they're looking at the other acute things that are happening and they're not correlating it with nutrient deficiencies, obviously. So that gets forgotten. I've had patients who've come in, and because we have electronic health records, I can see that they were B12 deficient 2 months or 3 months back when they came for an OPD follow-up or something, and I get it sent again because I know they were not put on any supplements, and I get sent again, they're still deficient, right? My heart attack patients who've come in like for the second or third time since we started the study. So we've had a couple come in since we started the study last year, where we're collecting the huge data, right? And we saw in those heart attacks that they were deficient that time, and they're deficient again because they didn't listen to us, and they weren't put on any supplements. Also, they still had the heart attack, and lipid profiles are normal because they were discharged on statins, right?
Right. Yeah.
Yeah. So yeah, that's one thing that I'm really trying to focus on, and trying to get attention of everybody. Why not work on this? Maybe this is one of the major causes, if you want to call it a cause,
Hmm.
or definitely an association. I mean, definite association.
Right. I'm curious to know, the people that you've that you've made aware of the fact that they're B12 deficient, if they started supplementing, have you seen that they, even if they may present with normal B12 levels after they've been supplementing for a given amount of time, do they still present with the same symptoms that are associated with B12 deficiency after supplementing? If versus if someone were to get their B12 levels back up naturally with like real food?
Yeah.
Is that the like have you seen that happen before, or is there not
I
been?
haven't, I haven't, I haven't seen that yet. First, my patients get admitted under other specialties and they're discharged under them. So
Okay.
very rarely do I get to write discharge medications or discharge orders. I mean, except for the ones that we're discharging from the ER itself. And for them, I can't get B12 levels done unless it's indicated. Uh, so yeah, but the data that we're collecting, we know patients who are on B12 supplementations, right? Because their B12s are coming like more than 15, and we take the history, right? So they've told us that they're on B12 supplements, and especially for the heart attack cases, and we've seen that some of them still have higher homocysteine levels. Maybe one or two have calmed down their homocysteine levels, but the others still have homocysteine levels. But I think it's a long way to go. Uh, and the rest, I don't think anybody's actually increasing their B12 levels. It's happened in my friends and family though. I remember one of my nieces, she sent me her reports, and her B12 was really low and homocysteine was really high, and I apparently scared her. But she started eating all the red meats and everything, and her B12 shot up, and her homocysteine absolutely settled down from like the 20s to like single digits. And yeah, that happened, and it's happened with a few of my other clients that I treat and treat through carnivore separately. It's not my hospital work, so yeah, it's happening over there.
Yeah, well, good. I want to sort of elaborate more a little bit. You already sort of elaborated on this originally, like earlier, but I see on your Instagram page, especially you're very active on there. You talk a lot about homocysteine concentrations and how those are associated with a lot of heart health outcomes, that negative heart health outcomes. Can you elaborate more on what the purported mechanism is? Have you looked into that at all? Is this something that you sort of suspected would be the case originally, or were you actually taken aback by seeing the associations between high homocysteine and heart health outcomes, negative heart health outcomes?
Yeah, so I mean, homocysteine is it's a protein, right? It's supposed to break down uh your coagulation cascade and no, not actually break down. It's supposed to help you clot your blood, right? And the more of it is the more of homocysteine is going to actually lead to coagulation, right?
Hmm.
And there are a lot of different. It causes endothelial dysfunction. It again destroys the glycocalyx. Uh, the, so that's important. I was through medical school. We had actually read about homocysteine being a procoagulant factor, and we used to learn more about homocysteine for strokes in patients who came in with strokes, since it was a hypercoagulable uh, disorder. We used to think about sending homocysteines and protein C, protein S, factor 5, and all that. And we started seeing in strokes that the homocysteines were high. So I used to speak to my neurologists. And first I used to ask them, this guy's come in, he's like 25, 30 years old. I did not think about nutrition at that time because, I didn't know. But, this guy's come in at 25, 30 with a stroke. Should we send his homocysteine levels and see, maybe that's high? They're like, oh, it's going to be high anyways because he's just had a stroke. I was like, why should stroke lead to an increase in homocysteine levels? Let me just still send it. And I used to send it, and it used to come up high, and then they would still be like, it's still going to come high. But then my research, I'm like, I've never read this anywhere that a stroke is going to lead to an elevation of the homocysteine levels. Maybe a little bit because as an inflammatory marker or something like that, but
Right.
otherwise, I don't think so. Yeah. Uh, but I never associated it with the lack of B12. I never got that done in those times. Then I started doing it in my heart attack patients and started seeing a little bit of the association. By that time, I was more metabolically aware of things. So, and that was a revelation to me because lipid profiles were what everybody wanted, yet people were having heart attacks. And this is one reason where, people can actually do something about it, and probably it's just getting missed out because you're avoiding all the foods. You're not increasing your B12 levels naturally. So your homocysteines are going to stay up, which can be reduced. There is a medicine for it though, homocheck. Obviously, I mean, once the pharma company gets wind of this, they'll be like, why do you want to eat and waste time and and take time to bring down your homocysteine levels when we have this homocheck or whatever that medication is called and break down your homocysteine levels.
Right. Yeah, well, that actually brings me
Uh,
to
and for your listeners, yeah, so why B12? Because B12 actually helps in breaking down homocysteine.
right. Yeah. I that actually brings me back to a point that I wanted to address earlier that you actually brought up. A lot of people will think that if someone classifies themselves as an omnivore in your practice, people underestimate what that actually means in terms of the amount of meat consumption they could be eating to be classified as an omnivore. Because really, an omnivore just means, I mean, just strictly speaking, it is an animal that consumes, at least the functional definition that people think of, that people use, is anyone that eats plants and animal products. And so there's no real specification as to what the ratio is that could make up plant and animal consumption. As long as there's some degree of animal consumption, you're considered an omnivore. How much are people that are considering themselves omnivores, how much meat are they actually consuming in your practice usually? Because it's still India, once again, is usually still a very vegetarian-based country. So I'm curious to know.
It's very little. Yeah. It's very, very little. Uh,
Yep.
I mean, through my data, once a week is, I think, the most frequent that people eat meat. Maybe on a Sunday or a special day. Sometimes twice a week, but most of the times it's once a week or once a month, you know. Uh, so it's not that much. And even, I mean, if you do your research online, you can see India's consumption, meat consumption per capita per year is like about 5 kgs or something.
Wow.
That's nothing there. I mean, I eat that in a week probably. Yeah. So
Yeah.
yeah, and that's per year per person consumption of meat in India. So it's really low. So yeah, I mean, when people tell me that, oh, I eat meat and still I'm having this, you're not having enough, and you're having a lot of anti-nutrients again, because you're loading it up with a lot of carbohydrates and oxalates and stuff, and yeah, I'm actually dumping oxalates these days.
Oh, really? What are your symptoms that you're dealing with?
Yeah, I'm having muscle twitching, some cramps there. So yeah, oxalates can actually pull out your minerals and electrolytes, right, a little
Yeah,
bit.
yeah,
So
yeah, because
yeah,
they
just
bind to.
supplementing that a bit. I'm not going down the fruit and honey path anyways.
Yeah, no, I don't recommend doing that. Yeah, I mean, there's so many things that can cause muscle twitching. I'll have muscle twitching once in a while as well, but I've also got
Yeah,
structural issues that are causing, impingement
yeah,
on nerves and stuff, so that caused it to happen. In fact, oftentimes that's what it is, because if I just shift my position, it'll go away.
yeah,
So,
yeah.
but
Yeah, but I was waiting for the dumps to start, because I've
yeah,
had my huge share of potatoes and chocolates, dark chocolates, almonds, beetroot, huge
yeah.
amounts through the years. I mean, so yeah, it had to happen
Oh
one
yeah,
day.
at some point. Yeah, I've wondered whether it's going to happen to me or not because it's been years that I've been carnivore and I haven't really had any symptoms of that. But I started whenever I was 18 years old. So I mean, how much
Yeah,
time did I really have to accumulate all that? I don't know.
yeah,
I think maybe I'm lucky that I was young and started this. Um,
absolutely.
yeah, but yeah, I wanted to ask you about that because I'm sure that a lot of people will respond. They do that. They do this even today with not to name names, but I'm going to name a name. Lane Norton online will say this a lot. He'll say, well, a lot of people say, well, the guidelines are really what's causing all of these issues. The dietary guidelines, what's causing all these issues with obesity and heart disease and all that. The problem, though, with that idea, according to Lane, is that well, people aren't following the guidelines. If they actually followed the guidelines, then you wouldn't see these issues. The guidelines aren't based on fraud or any pseudoscientific whatever. So I'm sure that you've gotten your fair share of people saying, "Well, it's not the guidelines. It's probably the people that aren't following the guidelines that are actually developing these issues." Despite the fact that I mean, part of the guidelines, not specifically the dietary guidelines, at least in the United States, but sort of a vestige of the guidelines and the science that it was based on, it leads doctors and other medical professionals to say that a vegan diet is still appropriate for people. So that's still part, you could say that that's still a part of the guidelines, and yet they'll still say, you're dealing with a bunch of effectively vegans. I mean, like we just covered that are still dealing with all of these issues that are purported to be caused by a bunch of red meat consumption and fat consumption. Sometimes they go as far to say, irrespective of the source, even plant-based fats, you shouldn't be having that. Just low fat completely, you know. So that's why I wanted to ask you that because I get that comment a lot. Well, it's not the guidelines, it's not the carbohydrates, because well,
Yeah.
it's that people aren't following them enough. They're just not doing it
I
hard.
mean, you need to come to India and sit down with the family and see what's in the plate. You will see the guidelines, the dietary guidelines on their plates.
Yeah.
Literally. I've done that so many times. I mean, I've had my share of rice, vegetables, lentils, and finished off with the fruit after that. So many times I've done that. And I mean, you go across India, you go to the south of India. the guidelines start with the breakfast where, they have carbohydrates of idlis and dosas and sambars and stuff. And you go to the west, it's again rice based. You go to the north, it's all processed flour and potatoes. Like, they have these parathas and they have chole bhatures. Uh, Even if you cook them in the right oils, that's okay. I mean, uh, they're all following the guidelines.
Yep.
You go to any Indian household, they will always have a salad. They will always have rice. They will always have the lentils dal. They will always have a vegetable.
Yep.
Roti is there. Come. I wants to say hi to you. Come. No?
No, no, okay.
Shy, yeah. And
It's
roti.
okay.
So yeah, he prompted me rotis. Yeah.
Yeah.
So that happens in every household. We're following the guidelines to the T. Yes, there is some processed foods that have come in. People have their dinners sometimes outside, still be vegetarian. Yes, they will be cooked in some refined oils outside, but at homes, I'm seeing that they're using mostly ghees, and coconut oils and some mustard oil, which is omega 9s. There's not much research on that right now. So, and we've been using it for like generations. So, I mean, that should be fine, I guess. But yeah, anyways, if you want to go into percentages, I would say probably 90% of the guidelines are followed in India,
Hmm.
right? And we've had diabetes since like 600 BC documented in India. So you don't have seed oils or refined oils. You do not have processed, ultra processed foods then. It's all there. So I mean, and then we are living proof that not eating meat keeps you safe.
Yeah. Well, the irony of that too is that I remember whenever I was growing up, which, I'm still growing up, but, mainly during my childhood era, um, I there's like this stigma around Indian food that is not negative, it's actually positive, that it's a lot healthier than Western food. Like ever since I was younger, ever since I was young, I've been taught that implicitly, explicitly. There's even articles that will try and, sort of emulate Indian food with the notion that it's healthier than Western food. And just,
Yeah.
I mean, it just completely neglects to mention that the diabetes rates in India per capita are higher than well, I think we already covered this before. I think they're higher
Yeah.
than any other country. I believe that
We are the capital. Yeah, 17% of the world's diabetics are from India.
yeah.
Yeah.
And
Yeah.
so I guess maybe it's because it just went, like you said, it was like sort of underreported, depending on what source you're looking at. Maybe that was that helped to sort of bolster that notion that it's healthier food, or it's just people thinking, well, the diabetes must be from something else. It must be from something else. It can't be from the traditional Indian food because, well, it must.
Yeah.
I mean, look at all these plants. Look at all the. So the irony is not lost with that one.
Yeah.
So it's not just the Indian people that believe that that's healthy food, like everyone in the West seems to think that it's healthy food. So
Yeah. Yeah, but I mean, to be fair to them, they actually classify the Western food as just processed, ultra processed foods, right?
right,
They think of Western food as pizzas and burgers and hot dogs and chips and sodas and stuff, right? They don't think about steaks. They don't think about lamb or ribs and stuff, right?
yeah,
And if you compare that to the Indian whole grain type foods, obviously it's better, right?
yeah,
Anything's better than processed and ultra processed foods, anyways. So I think that's the comparison they're making. But then it's again apples to oranges, right? Uh,
mhm,
There are a lot of people also in India who do not eat meat and they're still quite fit and healthy, right? They do require supplementation. Uh, and there are other things that are associated, right? So you need to be exercising, not be sedentary, smoking, alcohol, pollution, stress levels. These are also things which are really associated with metabolic syndromes, right? Metabolic diseases. So, I mean, yes, my study is about more of dietary preferences and nutrition, and my big one is obviously it's actually including smoking and alcohol and exercise levels and addictions and sugar. I had 85% of the people who add sugar to their foods or the tea or coffee every day, and 46% actually said they can't quit sugar. That- That's
man,
the level of addiction, right? So yeah, so
yeah,
I mean. all of these are included. But yeah, obviously, like I said, it's not just one single factor which causes, like, people come out and say, meat causes cancer, meat causes heart disease. It's going to be a combination of a lot of things, and meat is not a part of that combination.
Right. Yeah, that's
Actually, the absence of meat could be a part of the combination.
yeah. Yeah, and that's the other problem. If they're comparing their food to what they believe ultra processed food is, which they're correct, right, about what ultra processed food is. The problem is that they lump every single aspect and constituent of the ultra processed food in that category. So you mentioned hot dogs and burgers, then they're going to believe that since meat is most commonly associated with a bunch of these ultra processed foods, that meat must also not be good either. It must be one of the major contributing factors. Not to mention that meat itself, people have this no one of the reasons, this is a hypothesis, but I think it's pretty obvious. One of the reasons why people immediately believe that fat, especially animal fat, the saturated fat, is causal in things like heart disease is because the mechanism is like the purported mechanism is so clear even to a child. They believe, well, the fat is hard, and therefore, when you look at arteries, it's hard plaque. So therefore, boom, done, slam dunk. That's what's causing it. So that doesn't help. That doesn't help either because then you're just gonna see a bunch of fat on a plate or something and be like, well, that's good. Heart attack meal right there. And it's like it doesn't help. And that's one of the most. I think that's one of the biggest bulwarks and obstacles to get over that is preventing us from actually getting this notion that meat and animal fat is not what's causal in heart disease. Is this just the idea that, well, it's solid at room temperature, whether people even
Yeah.
think it consciously or not? Like they look at the fat, because I know I did this whenever I was younger. It's like, oh, well, the fat there, that can't be good for my arteries. It's just going to build up. I think
Yeah.
that's one of the biggest
Yeah.
obstacles. It
Yeah.
sounds so superficial, but I mean, and it is. But I
People
mean,
do think, yeah.
yeah, it's
Just
a,
visualize it, try to visualize it.
yeah, I think that's one of the biggest obstacles, frankly. Um,
Yeah, absolutely. I mean, I'll tell you, most of the people don't actually know that cholesterol is naturally made in our body and it's naturally made in our brain and the liver and everywhere, and that it's a precursor to so many different hormones, and it's part of a cell membrane. People actually don't know that.
yeah,
If they come up and ask me, what about my cholesterol? I'm like, yeah, what about it? Tell me about cholesterol. And they have nothing. They're like, doesn't it cause heart disease? I'm like, how? We don't know. The doctors only say this.
yeah,
Right. And when I tell them what it's all about, they're like, all right, nobody actually told us this. And when I share my data with them and all of that, and I mean, then their eyes open. But I think it's important for them to know what cholesterol is. That's the main problem. People have hid it. I think most of the doctors also won't be able to describe what cholesterol is.
yeah,
No offense to any of the doctors out there. We forget.
yeah. Yeah. Have you actually been getting people to change their diets in your practice? I mean, you just said that 46% of a certain group of people in your practice have just completely they've dismissed the idea of dismissing sugar entirely or removing sugar from their
Yeah.
diets entirely. So we clearly see that some people are not willing to make that change. But ha have you been getting at least some people, even if it's the minority of people, and is it the minority or the majority of people, to change their diets in their practice or in your practice?
Yeah, it's minority right now. So they've started to follow me on my Instagram, and sometimes they come in for a consult or something. Uh, but yeah, I mean, some of them take my number down and they get in touch with me and let me know what they're eating, not eating. That ways, and I try to follow up with them. So it's still a minority, but yeah, I mean, it's one step at a time.
Right. Yeah. You would you say it's
Yeah,
about
it's
like
good execution.
20% or even less than that?
10% maybe,
Oh,
maybe
wow.
even
Yeah.
less. Yeah,
Yeah.
yeah, yeah. I
The
actually and it's difficult in the emergency also to keep them uh, uh you know keep them engaged for a long period of time because obviously they're not that well at that time. So I
yeah.
mean, once I have the discussion, the sometimes that we follow up with them in the wards and let them know. Sometimes I ask the FNB departments to actually give them the foods that I am telling them to be given. uh, I've had some friends and families who got admitted who were not carnivores, and I made sure that they get the right foods when they were admitted and not the standard uh, carbohydrate loaded hospital foods that's available across the world, which is absolute crap.
Yeah.
And I get their foods made in butter or ghee, and it's just eggs or chicken or fish or mutton, and that's what they're served. And by the time they get discharged, they feel quite well. So I've had a few who've actually, after discharge, have come in for a carnivore consult with me, and they've taken on to the carnivore lifestyle. So yeah, that's happening.
Okay. Yeah. Good.
I mean, it's
Good.
going to take some time, but yeah, my main aim is to, open as many eyes as possible, especially doctors, and also, at all my emergency medicine conferences, I'm like, I don't want to talk about emergency medicine. I want to talk about metabolic syndromes in emergency departments because nobody's thinking about that. Nobody's thinking,
Yeah.
and that's my maximum subset of patients that are coming in, complications of those metabolic syndromes, right? I mean, like probably 5% is trauma. The rest 95%, even if I have infections and sepsis and critical patients, uh, they're so sick because of an infection because they're metabolically broken, right? And
Right.
their immune systems and immune functions are not functioning. They're all down. They're nutritionally deficient, mitochondrial dysfunction. So, even those, and then you have your heart attacks and the strokes and your dementia patients who come in with complications, the falls with fractures, trivial falls with fractures, cancer patients coming in with complications or the complications of chemo, radio, surgeries, whatever. All of those, that's 95% of our patients who we can actually either cure or prevent from getting these just by the right nutrition. And that's why,
Right.
I've started to tell people, help me save your lives by not even coming into the emergency department. Because, if you reverse all of this, you won't need your lives to be saved by me.
Yeah. Do you think the reluctancy for people to change their diets though is due to addiction? More, like, do you think it's more so
Nah,
to do with addiction, or do you think it's a fear of change? Like they're just
I think it's a fear of change and their beliefs. Yeah,
okay, yeah, yeah.
yeah,
I was
yeah,
curious to know because I mean there is once again, as you said, there's an element of addiction when it comes to things like sugar, but when it comes to other things like lentils and rice, I don't know if there's as much of an addiction property there.
yeah. I mean, for rice, I think there is
Well,
subconsciously people are addicted to rice because
yeah.
it's fantastic, right? So it takes the flavor, it takes the flavor of whatever you're having, and
Yeah.
and then subconsciously you want to eat more of that because you can get the flavor of the curries and that, right? So
Yeah. That's
uh,
true. That's true. Yeah. Um, are you going to be in these studies, are you going to have regressions that sort of like linear regressions that remove things like the smoking from the data set to sort of get a clearer picture, a clearer association between a certain metric like LDL or something like that and heart
yeah.
disease? Are you going to do variations of those? That's sort of a
Yeah, I'm going to
subset of the
try.
question.
So yeah, I'm not an expert in that, but I'm going to sit with a statistician and go
Yeah.
through everything that I want to look at. If I want like just a subset of patients, okay, fine. So many 65% are vegetarians. How many of them smoke? Let's remove them. Okay,
Yeah.
how many of them have alcohol? Let's remove them. See what's happening. Or if we have alcohol and smoking, how many of them are in this or in the omnivores? So I'm going to do all of that. So I was supposed to collect data till December, but I think we're getting our end number completed by in the next couple of months. I'm like, that gives me 2 or 3 months because it's going to be really extensive, and I'll have to show my vision to the statistician, right? To get me the right analysis, and it's going to be to and fro, to and fro. So yeah, we're going
Yeah.
to do as many regressions as possible, and get as many subsets as possible.
Yeah. Yeah, I think that's important. I think the it's important to have the complete regression without any manipulation whatsoever. So all the patients
Yeah,
and then, association between diabetes, heart disease and all that. And then you can start sort of you could call it controlling for, but
yeah,
really what you're just removing people from the data set to see is there a clearer association between, just strictly LDL levels and this. I think a lot of times studies will just they'll only report the second part and not the first part, and that's when it becomes a problem because you're
yeah,
removing
yeah.
you need to see the whole picture, it needs to be at least included. But
So
yeah,
that's what I'm thinking of doing. I'm going to show the whole picture first. All right, this is my 10,000 patients.
yeah,
This is what it shows, right? And then, okay, fine. Out of these 10,000, these 5,000 has this. We're removing smoking from it, so I'm left with 2,000. This is what it shows.
yep,
With smoking, this is what it shows. Omnivores with smoking, without smoking, this is what it shows. Yeah. That's my plan. Like tables and tables and tables,
yep.
keep reading.
Yeah. Well, that does bring me to my last question here, which is you already mentioned this with one of the studies. You're going to be tallying things up and really expecting for the study to be, at least if I'm understanding correctly, available to the public December of 2026 is what you said, or is that whenever the data is being finished collecting or is going to be finished collecting?
Finish collecting, yeah, finish
Okay.
collecting, yeah.
Okay. So it'll actually be even later that the study is released,
No, so,
right?
so my biggest one, it's going to the collection's going to get over probably by July end or in mid-August, something like that.
Okay.
That's my aim.
Right.
And obviously analysis is going to take about a couple of months for
Yeah.
sure.
Yep. Okay.
And then we're going to start sending it, writing it up and then sending it for publication. So probably like March, April or something, it should be sent for reviews. Don't
Okay.
know when it'll
Okay.
get published. Depends. Yeah.
All right. So it'll still be a little while, but that's all right because
Yeah.
longer
That's
studies
just
are
one of them. That's just one of them. We're doing about 9 studies right now. Yeah.
okay. When do you think people will start to be able to look at any nine of them? You know, when's the first one going to be released? Because I'm
Next
anticipating this.
next year.
Okay,
Next
next
year.
year.
Next year. Yeah.
Okay.
But
And
I'm
then
but I'm definitely going to publish a few case series. My SVT with homocysteine association is under review right now. I'll be writing some more case series. So yeah, I mean that you can read at least in the meantime.
yeah, yeah. Well, you mentioned this at the very beginning, but if there's any more answers to this question, they would be greatly valued. How can they be? What is the plan in terms of accessibility of these studies? You know, where will they actually be accessible? You talked about New England Journal of Medicine as one of them. What are is it all the medical
No,
journals?
no, no, not New England. Yeah, that's going to be difficult. So the American Journal of Emergency Medicine, that's my
Ah,
plan.
okay. Yeah,
Yeah,
yeah.
that's one of them. That's one of them. And there are a few other emergency medicine journals like the Annals of Emergency Medicine. We've got Journal of Emergency Medicine, International Journal of Emergency Medicine, uh, Turkish Journal, and the World Journal of Emergency Medicine. There's some of them. There's another one I found yesterday, which is really nice. That was nutrition and cardiovascular diseases.
Ah, there
That's
you
a
go.
PubMed index journal. So I thought this would be perfect for one of my studies. So I looked into that. So they've got some highly cited papers over there. So yeah, could be that and yeah. So it's all going to be on PubMed index journals. So if people want to go and find journals, I mean, they can just go to PubMed and then find the article over there.
All right.
Hopefully, yeah.
Yeah,
I
yeah.
mean the STEMI and homocysteine is already there on PubMed and the AJEM. So you can download that from PubMed, I think. And I don't know if it's free.
Yeah. Well,
I don't I
yeah.
don't I
There's
don't think it's
ways.
open access. Yeah, because it's really
Yeah.
expensive.
There's ways to get around the paywall. I won't say it on the channel right now. People want to check. I have ways to go
Don't
doing that. So yeah,
don't. You
yeah,
don't want to get banned by those journals also.
yeah, yeah. No, I also don't want to call out that method because it might be taken down. So I don't want to do that. But
Yeah.
anyway, so there's ways around it, fortunately. But yeah, no, awesome. So there's still some up that people can check out if they are curious. And I mean that's really all I had for you. It was nice talking to you about and getting more information about this because, like I said, I am looking forward to these studies because I mean. We need more recognition. As much as we're getting a lot more recognition, we still need more.
Yeah.
Like, you cannot get complacent. Be like, oh, we got enough now. No, never.
Yeah.
Keep going.
Absolutely,
Keep
man. Yeah.
keep studying. So, yeah, no, I'm looking forward to those. And once again, I mean, thanks for coming up on the channel.
Yeah. Thanks for having me, Eddie, man. It was an absolute blast.
Yeah. See you soon.
Take care.